Accessing health care can be more challenging in our rural communities. A recent report by Virginia's Select Committee on Advancing Rural Health Care shows thousands are not getting consistent care. Now, the General Assembly hopes to tackle these disparities. WDBJ7's Colby Johnson spoke with a state lawmaker and a rural hospital to identify the problems and figure out future solutions.
The General Assembly's Bipartisan Committee on Rural Health Care was created to study and address the disparities in health care access facing rural Virginians. The committee's chair notes that tens of thousands of Virginians don't have access to basic health care simply because of where they live.
If you look at the statistics, not only do they lack more access to care in terms of providers and health systems, including hospitals, people in rural areas do not live as long as those in more urban areas, and that's just absolutely wrong.
The committee's report found that one of the biggest barriers to healthcare access in rural areas is transportation, which can be particularly difficult in mountainous areas like Franklin County.
We still have a lot of transportation issues within the county and getting patients to a hospital or getting patients to a doctor's office or transporting patients for dialysis.
Carl Klein is the VP at Carilion Franklin Memorial Hospital. He says they're making healthcare more accessible and recently renovated operating rooms to add more surgeons and see more patients.
We have increased the general surgery cases that we do here. We have increased the OBGYN cases and the types of cases that we do here at Franklin Memorial. We have increased our orthopedic work.
Delegate Rodney Willett says the General Assembly's ongoing session will see a number of bills and budget amendments aimed at addressing rural health care issues. One example of this is a plan to remove hurdles to access telehealth options for people without reliable internet.
Right now in Virginia, in some cases, we're not allowing for audio-only telehealth, and there's some places where people do have a cell connection or landline. They could be accessing a medical professional. Right now, the law doesn't allow for reimbursement for that for providers, so we're going to try to lower that.
Carl Klein says ultimately the biggest key to addressing rural health care is for hospitals, clinics, and other organizations to frequently communicate and collaborate with local governments and agencies. In Rocky Mount, Colby Johnson, WDBJ 7.